Hello, everyone. I'm Dan Kleffler in New York, and this story developing now. Health officials in New York City are closely watching a possible new case of Ebola. A 33-year-old healthcare worker identified as Dr. Craig Allen Spencer, who recently returned from Guinea, arrived in New York through JFK Airport. And Josh Arniger from our New York station, WABC TV, has the latest now from Bellevue Hospital.
He arrived here at Bellevue about 4 hours ago now at around noontime when he came here in a specially modified FDNY ambulance with paramedics trained for this eventuality. He's here right now being monitored inside Bellevue Hospital. Caution you, we do not know that this is Ebola. It could be any number of things from malaria to the flu, but the circumstances here, the city is saying, are enough to monitor him for potential Ebola. They have taken a test of his blood and they are awaiting the results, which will come back in the next 12 hours. This is a doctor who works with Doctors Without Borders and was volunteering in Guinea, which is one of the 3 Ebola-stricken nations in West Africa, returned home in the past couple of weeks. And the organization says he has been self-monitoring, self-quarantining in his home in Hamilton Heights, and this morning reported having spiked a fever. We are told it is about 103-degree fever. The city called the FDNY, and they came and got him and brought him here to Bellevue. Bellevue, one of the 8 hospitals throughout the city that has prepared for this eventuality. It is the primary hospital, though, and was always said to be the hospital that would be the first to see a potential Ebola patient. Again, it is not positive that he has this illness, but because he's a doctor who was in the target area in West Africa and treating patients potentially who had Ebola, this is something that, of course, they are not taking any precautions. He is here in isolation, being tested, and also being tested, by the way, for other illnesses, malaria and other things that could explain some of the symptoms that he reportedly is feeling right now. So that's the situation here outside of Bellevue, and of course we'll continue monitoring it from here. For now, we are live. Josh Einiger, Channel 7 Eyewitness News.
A lot of questions, obviously, in this case. So for some of the answers, I want to bring in our Chief Health and Medical Editor, Dr. Richard Besser. Dr. Besser, thank you for being with us. So what are we hearing about this particular case?
Well, clearly there's enough suspicion that this could be Ebola that the health department is taking it very seriously. They've already started trying to identify contacts of Dr. Spencer, because those are people that they would need to track for fever. This is very different from the situation in Dallas, where someone walked in unexpected to an emergency room.
Working with Doctors Without Borders in Guinea, had returned back a couple of weeks ago, had been self-monitoring, self-quarantine, I think is how it's being described. So that is still potentially, though, within the time frame of a development of the disease, correct?
Yes, we've learned he returned 9 days ago. He returned on the 14th, which is clearly within the 21-day window. We don't know the last date that he had contact with patients in Guinea. He would be in that group that would be self-monitoring. So he wasn't quarantining. He was doing self-monitoring, meaning checking his symptoms, checking his temperature, and according to Doctors Without Borders, their instructions to their personnel are to report any symptoms. He did that, and they instructed him to make the connections with the health department, or they made those connections, and he was transported safely to the Bellevue Hospital.
I wanted to ask you about Thomas Eric Duncan. When he was first admitted to the hospital, there was a lot of back and forth as far as his temperature that was being reported. With a 103-degree temperature, can it spike that quickly, or can it be a gradual increase?
You can see either situation. We were hearing that Amber Vinson, one of the nurses in Dallas, had a low-grade fever around 99. It's not a fever, but an elevation of her temperature to 99, 99.5. Here we're hearing about a temperature spike to 103. It's hard to say whether that makes it more or less likely to be Ebola. You can see that with salmonella. You can see that with typhoid fever. You can see it with malaria. We do understand from the CDC that in this setting, things are suspicious enough they would be putting together a team that would come if the results are positive here. That's what they did ahead of the results from Dallas, and that's what they would do ahead of the results here.
And when are we expecting a timeline on those results?
The health department has said that it will know within 12 hours. I would expect it will be much sooner than that, given that the laboratory, is here in New York. It's not like Dallas, where they had to send the samples to Austin. The laboratory is in New York and will be able to do that test.
As we've been seeing now, Is there a team that's in place then just as a precaution, or is it a team that goes into place once the the results have been determined?
Well, New York City Health Department has a terrific group that does their infectious disease outbreak investigation. They have a lot of people who trained at CDC. When I was at the CDC, if there was going to be a health issue, New York was the place we knew that could handle it. We would provide them support, but they're very deep in that bench. And they've been practicing. We had the deputy commissioner on this week, on Sunday, Dr. Jay Varma, and he talked about the training that they've been doing, that Bellevue has been identified as the hospital that would be taking care of a potential Ebola patient from anywhere in the city. They've been drilling, they've been practicing. And in terms of contact tracing, that's something that this health department has a lot of experience doing, not just because of a disease like this, but they do it for tuberculosis all the time. Dr. Frieden, who's the current head of the CDC, was the health commissioner here before he went down to the CDC, and I expect that they will be on their game.
Talk to me a little bit about what the next 24 hours will hold then for Dr. Spencer then, as far as being in this isolation unit.
Yeah, so he'll be in isolation. They'll be monitoring him. They'll be providing supportive care regardless of what the illness is. They'll be testing him not just for Ebola, but for other infectious diseases. They'll be monitoring to make sure his kidneys are working properly, that his fluid status is appropriate.
The differences now between Bellevue tonight and Bellevue, say, a week ago, given the fact that now there is new CDC guidelines in place for any kind of practices and procedures for handling a potential case like this.
Yeah, I mean, a lot of hospitals had moved to what CDC is recommending ahead of CDC, and we're already at the point of saying, if we have someone like this who's highly suspicious for Ebola, we're not going to have any staff taking care of that person that has any exposed skin whatsoever. So, as Dr. Varma has said on our shows and during a Facebook chat on Friday, they are on the ball. They are ready. Their staff will be protected in terms of gear that they're wearing. I don't know how much experience their staff have in terms of wearing that gear and taking it off properly, but the new CDC guidance calls for that to be observed. There'll be a monitor there to watch it and make sure that people are doing this properly. The CDC guidance calls for a buddy system so that no one is in there taking care of a suspect or confirmed Ebola patient alone. There's always someone watching to make sure there's no break in infection control. And then there's somebody who's trained to help them come out and get decontaminated. All of those things should make it safer for people who are caring for Ebola here in America.
And lastly, just one more time to emphasize the fact that this is a different type of situation given previous cases that we have seen here in the United States, and the fact that this was someone that was self-monitoring, correct?
That's right. This is someone who is self-monitoring. The nurses in Dallas were self-monitoring as well, but this individual was self-monitoring, and we understand had that fever spike today, called Doctors Without Borders. They connected with the health department, and transport occurred. And so hopefully there was no exposures along any of that path. We'll know more as we hear more about their investigation and how many contacts, if this turns out to be Ebola. But it is important for people to realize there are a number of diseases this could be. We don't have that confirmation. It'll be a while before we have that.
All right, ABC's Dr. Richard Besser with us. Dr. Besser, thank you so much. I always appreciate it. Of course, you can keep up with the story in real time by downloading the ABC News app and starring the story for exclusive updates on the go. For now, I'm Dan Kleffler in New York.